RANZCOG acknowledges and pays respect to the traditional custodians of the lands, waters, and communities across Australia, on which our members love and work, and to their elders, past, present, and future. Good evening and welcome to the live stream of this Q&A, COVID vaccination in pregnancy, breastfeeding, and those planning to be pregnant with Dr. Vijay Roach and Professor Sue Walker. Thank you very much for this opportunity to present on this very important topic. Thanks Sam and the Pink Elephant Support Network. My name is Andre Curry. I look after communications at the Royal Australian and New Zealand College of Obstetricians and Gynecologists. Before I introduce Vijay and Sue, a couple of housekeeping things from me. There will be short presentations from Vijay and Sue, and we have had questions submitted to us prior to tonight. You can also ask questions in real time via the chat. Please do, and Vijay and Sue will do their best to answer, time permitting. And please, let's be mindful of being respectful in the conversations and chats that we have tonight. So here are our speakers. Sue is a maternal-fetal medicine subspecialist and an academic clinical researcher. She has founded and continues to lead the perinatal medicine department at Mercy Hospital for Women, which has flourished into a tertiary referral site for some of the highest risk pregnancies in Victoria. Vijay is an obstetrician and gynecologist who works in both private and public practice in Sydney. He has been the president of RANZCOG since November 2018. Vijay is co-chair of the Pregnancy and Perinatal Care Panel of the Australian Government's National COVID-19 Clinical Evidence Task Force. And now here is Vijay and Sue.
Thanks a lot, Andre, and thank you for those introductions. And welcome everybody. Hopefully, we're working on trying to get this through to Facebook. If any of you have the capacity to assist with that, go ahead. And but it will also be recorded. So if you're talking to friends who haven't been able to access it tonight, then it will be available after this. So I'm a general obstetrician and gynecologist. I've been looking after pregnant women for many years. And one of the privileges, I think, of my job has been sharing the journey with so many women and their partners and families who have experienced miscarriage. And maybe that isn't an expression that you hear all the time, but what we do is a privilege, and being with you during that time is something that I value and value deeply. And so recognizing that for many of you who will be here tonight, that miscarriage or pregnancy loss or difficulties during pregnancy have impacted you at some point in your life, I want to acknowledge that, and I want to acknowledge that some of the conversations that we might have tonight could also be triggering or difficult, but that we care about you, and that's why we're here. So COVID has impacted all of our lives, and this short presentation is really just so somebody needs to mute if they could.
Lisa, your phone. Can you please mute your phone, Lisa?
This is for the suits. That's all inclusive of all of this. And this is his black burglar ski mask.
Lisa, would you be able to mute your phone? Cool. So we're just gonna. So this is just a short presentation talking about COVID generally and COVID vaccines and pregnancy.
Most pregnant women who catch COVID-19 have no symptoms and remain well. However, severe illness and hospital admission is more common in women who are pregnant, particularly if they have underlying health conditions. If you
very smart use of virtual paneling in the bathroom to save money. Yeah, no, we're really
information on the safety of the COVID-19 vaccines in non-pregnant women. But clinical trials in pregnancy are only just starting, so detailed information about the risks and benefits are not yet fully known. However, information from thousands of pregnant women who already had the vaccines as part of general use do not indicate any harm to the mother or baby, which is very reassuring. COVID-19 vaccines do not contain live coronavirus and can't multiply in the body, so they cannot infect an unborn baby. They do not contain any additional ingredients that are known to be harmful to pregnant women or their developing baby. When you are offered a COVID-19 vaccine during pregnancy, you should make an informed choice that is right for you and your baby. Find out all the information you need to make up your mind from a trusted source, such as your midwife or doctor. Women who are trying to become pregnant do not need to avoid pregnancy after vaccination. There is absolutely no evidence that the COVID vaccine affects fertility in either you or your partner. The World Health Organization recommends that COVID-19 vaccines are safe for breastfeeding women, as there are no known risks to the infant, and breastfeeding has so many other benefits. If you want to find out more about how vaccines are tested.
So COVID-19 in pregnancy for many, many women is an illness that might be mild or moderate. However, and this is becoming more and more clear, is that pregnant women, if they develop COVID, are at greater risk of severe disease. They have a higher chance of being admitted to hospital, and once in hospital, admitted to ICU, being ventilated, and unfortunately even dying. And we know that for their babies, there's an increased risk of prematurity and stillbirth. And so I think that if there's a take-home message, there'll be several take-home messages, but one critical one that we have to get across is that we're not talking about a mild illness. We're not talking about the flu. We're not talking about getting a cold. We're talking about COVID, and COVID is bad. You do not want to get COVID because the impacts on you as an individual, pregnant or non-pregnant, the impacts on you as a pregnant person will be amplified, and potentially the impacts on your baby. So how can you avoid COVID? The way you can avoid COVID is with COVID vaccination. And it took us a while to arrive at this point. We waited until we had data. We waited until we were sure. We thought about it. And then RANZCOG, along with the TAGI, issued our advice, and pregnant women were advised to be routinely offered Pfizer or Moderna, so an mRNA vaccine. And Sue's going to explain more about what that means. And we also were able to think about it, and the thought that I want you to get into your head is this concept of biological plausibility. What is it logical that this vaccine could impact your sperm or your egg or the baby that's to be born? And particularly in the context of pink elephants, the very early baby. And if the vaccine, having gone into your arm, is broken down, it sends messages, and Sue will talk about that in more detail, but there is no vaccine that remains in your body. And so women who are trying to become pregnant don't need to delay vaccination. You don't need to avoid becoming pregnant after vaccination. The bottom line, and we'll keep repeating the same message, is just get vaccinated. And we know that it's safe in pregnancy and in breastfeeding. And then there's your baby. You've waited for this baby. This baby is going to be with you for a long time. We want to protect this baby in the best way that we can. And you do that in so many other ways. The vaccination will give antibodies through the placenta and potentially through breast milk. We don't have any evidence of fetal harms or miscarriages, and there is robust data, and Sue's going to go through that. We don't have any evidence that there are harmful effects to the mother, and we're leaving aside AstraZeneca tonight because that isn't the recommended vaccination in pregnancy. And vaccination doesn't prevent infection all of the time. So therefore, all of us who are doubly vaccinated, who are looking forward to, in New South Wales in particular, the freedoms that we're going to have as a result of being doubly vaccinated, we still need to be aware that we can contract COVID and that we can give it to other people. And so therefore, at least in the short term, we need to continue to wear masks where appropriate. We need to socially distance and wash our hands. But if you are vaccinated, whether you're pregnant or not pregnant, but particularly in this context, being a pregnant person, your chance of becoming severely unwell, being hospitalized or dying is dramatically reduced, if not eliminated. So you can see on the screen there are a few questions that just are the repeated questions that people ask. And maybe that's another thing I wanted to emphasize tonight, is we're not coming here from some sort of ivory tower to tell everybody what to do. And I've been reflecting on the fact that I actually am not judgmental of the so-called anti-vaxxers or the people who don't want to be vaccinated. I don't think that that's fair, and I think that that's a sort of, presumptuous on my part. We all have complex interpretations of risk. And when you've experienced miscarriage or you've experienced pregnancy complications, your perception of risk is altered. The way that you see the world is changed forever. And it isn't for me or anybody else to tell you it'll be fine, because in your experience, it hasn't been fine. But what we wanted to do was to work on the scientific understanding that we have, the information that we have, to reassure you. And we wanted you to know that by having a vaccination, that actually you're protecting yourself, and you, the mother, are the most important human for your baby's life. And so protecting you is our highest priority. And in protecting you, we will protect your baby, and we won't be placing your baby at risk. In fact, we'll be doing exactly the opposite. So we'll talk through the different sorts of vaccine. If there's a small group, it will become less relevant, who had a first dose of AstraZeneca and then found out that they were pregnant. What to do, when you are trying to conceive, as we said, it's still okay. If you're unwell or have other illnesses, and breastfeeding, and of course that question about long-term risk, a very difficult thing to answer when we have a new disease and a new setting, but we'll address that. And of course, just the things that happen if you have a vaccine, that you can react and you develop a fever. And the routine things that you should continue to do in pregnancy: flu vax, pertussis vaccinations. Those are the things we always recommended. And I did have a line in there before about anti-D. So that anti-D, if you're rhesus negative, you have that when you're pregnant, then that's got nothing to do with COVID. So all of that usual pregnancy care should continue. And we talked about masks and washing hands, and you should encourage everyone around you to be vaccinated, because it not only protects those people you care about, but also will protect your unborn baby. And just lastly, before I hand over to Sue, this concept of medical exemption. So there are circumstances on which someone shouldn't be vaccinated. If they're allergic to a component in the vaccine, then it's not appropriate for them to be vaccinated. But pregnancy, if you think about it, can't be a reason for exemption, because that's the group we want to be vaccinated. So there was some confusion, as there often is, and we've seen so often in the pandemic, with communication, with government forms, and we've been working very hard to try to get them all uniform. But our consistent advice is that pregnancy is not a reason for medical exemption. So on that note, I'm going to hand over to Sue, and then she's going to give you a presentation, and then we'll come back and work our way together through some of the questions. Thanks, Sue.
Thanks, Vijay, for that lovely introduction. And I'd just like to thank Sam and all of the Pink Elephant team for inviting me to join you this evening. As you've heard, I'm Sue Walker. I'm maternal-fetal medicine subspecialist, and so I work a lot in the area of high-risk pregnancy, and particularly at the moment, unfortunately, working with a lot of women who have got COVID in pregnancy. I also would like to acknowledge that I come to you from Wurundjeri land of the Kulin people, and acknowledge all their elders past, present and emerging. And I would also like to acknowledge that I know that October is Pregnancy Loss and Stillbirth Awareness Month, and that will resonate with many of the people who are on this call. And like Vijay, I would just like to thank you for joining this evening to express our understanding and our solidarity with your situation and why you may feel hesitant about vaccination, and also to say how much we welcome your questions. And so in addition to those FAQs that Vijay just put up, I also went through the list that was submitted to Sam, and I can see that many of you are really well and widely read about vaccination and miscarriage and what might be special considerations for you. So I thought what might be be helpful is if I could sort of put together a bit of a presentation where I hope I can draw together the answers from most of those questions. But then, of course, I'm completely happy to share any other questions that you have. Sorry, Amanda, was that for me to mute my audio, or was that somebody else? Just saw that in the chat. Are we okay?
Yeah, no, I think you're okay. I think that was for the general crowd, people joining.
Okay. Okay, cool. No problem. All right. So let me just start off with this, and hopefully by now you can see my slides okay. Great. And then I just need to do one more thing up here and just make sure that you can hear the sound. Okay. So COVID vaccination, for many of you, you'll be thinking about it before pregnancy. Some of you will already be pregnant and some of you might be breastfeeding. So that's really what Vijay and I are hoping that we can answer your questions about today. So I guess wherever we are, whichever press conference we're listening to, all we hear at the moment with roadmap is roadmap means vaccination. That the only way out of this pandemic is with safe and effective vaccinations. And unlike any other pandemic, we have been extraordinarily fortunate that we found safe and effective vaccines very, very early in this pandemic. But remember, this has been built on decades of research that has preceded this pandemic. And of course, we know with vaccination that it'll reduce hospitalisations and it'll reduce deaths and it'll make ICU beds available for people who need it for cancer or heart disease. We know that we'll get a passport. We'll be able to go back to the MCG or whichever your favourite venue might be. We know that it'll save the economy. We know that we'll be able to travel again. We'll know we'll be reunited with family from interstate and overseas and even locally. But it's very understandable that for pregnant women, they think specifically about what about me and my baby against this whole community context. Will I be vaccinated now? Will I be vaccinated not yet? Or will I decide vaccination not ever? And so I'm hoping that I might be able to get you to the first response by the end of our seminar this evening. But as I say, we're really happy to take any questions on why you might think not yet or not ever. So as Vijay's alluded to, COVID-19 in pregnancy is bad. And unfortunately, Delta virus is much more infectious than its predecessors. This means that certainly in Melbourne at the moment and Sydney before us, we're very aware that it is almost impossible for everyone in the family not to get COVID when one person in the family's got COVID. So even though as a pregnant person you might be staying home, not going to the supermarket and so forth, we've had so many families where my partner just ran to the chemist to get something for our little one and caught it there. And then not only was I infected, but my children were as well. So the advantage of vaccination is not only that it protects you, but also protects potentially your young children from getting infected, given that the vaccine at the moment is not recommended for under 12 in Australia. We know that COVID-19 in pregnancy is associated with a higher risk of hospitalisation. So we're seeing about 1 in 6, about 15, 16% of women who are pregnant with COVID, they need to come into hospital. And as Vijay's already alluded to, of those who need hospitalisation, we have a doubling in their risk compared to women of reproductive age who are not pregnant, of pneumonia, of intensive care unit admission and of death, and a 3-fold increase in the need for intubation or ventilation, or what we call ECMO. That is where we have a heart-lung machine that completely takes over oxygenation of the blood because the lungs are no longer able to oxygenate the blood for the mum. Severe COVID-19 also confers risks to the baby of preterm birth, of stillbirth, and to both the mother and the baby of an increased risk of caesarean birth and preeclampsia. Of mums who come in with severe COVID-19, the majority of them will end up being delivered during that admission. And unfortunately, this often means babies who are preterm, who are born sick, small, ready or not. So the increase in preterm birth that we see with COVID-19 is not because of an increased risk of preterm labour, but because the mum's heart and lungs and other organ systems are under such strain that we need to deliver the baby to try and give her a bit of relief. So compared to last year in Melbourne, where we had our first big outbreak, the big game changer this year, as you've heard, is vaccination. And we know that vaccination prevents hospitalisation, severe illness and death. But we also know that vaccination is part of the national roadmap. It means that we are going to open up. And so it means that if we have a population who are unvaccinated, they are going to be particularly vulnerable. I'm not going to show this video because Vijay's just showing this, but just a reminder, the key messages from that video are that COVID confers increased maternal and perinatal risks in pregnancy. New and different vaccines have rapidly come to the market, which we know to be safe and very effective in reducing hospitalisation and death from COVID-19. We know that unfortunately pregnant women were excluded from the early vaccine trials, but we do have an enormous amount of data now on what we call post-vaccination surveillance. That is, hundreds of thousands of pregnant women around the world now have had the vaccination during pregnancy, and we've followed them up to see what happens during their pregnancy into their babies. We know that the COVID-19 vaccine components are safe. There is nothing in the preparation or in the preservative that is not safe in pregnancy. We also know that other vaccines are safe and effective in pregnancy. And as always, we would always say to you, please feel free to discuss this more with your midwife or your doctor, or increasingly as it's getting into the community, into your pharmacies or at your vaccination hubs if you have any other unresolved questions. Okay, so I guess everybody worries about, could the vaccines cause fetal harm? And all of us can relate to this in pregnancy. We've been told for generations, don't take anything when you're pregnant, don't take anything when you're pregnant. And of course, it seems a little bit inconsistent that we're now saying, accept this, take this thing that is new, and we really want you to have this in pregnancy. So I guess there are three questions that I'd like to be able to answer for you to try and help you answer this question for yourself. The first thing is, as Vijay alluded to, is it biologically plausible? That is, does the vaccine contain dangerous components that can access the fetal compartment and therefore might potentially cause long-term sequelae for the baby? The second question is, what do we know about other vaccines in pregnancy? And how do they work? And finally, what's our experience now of this vaccine in pregnancy, now that I've just said to you that we've now got lots and lots of post-marketing surveillance? And I could see from the questions that came through that there were a lot of questions about miscarriage. So I apologise to any of you who hate data, but I'm just going to take you through some of the very recent data about pregnancy outcomes, and in particular the two publications that have come out in the last couple of weeks regarding miscarriage. Okay, so let's turn to our first question first. Is there any plausible reason that we think that the vaccine could be dangerous to the fetus? So let's first ask ourselves, what is in the Pfizer vaccine? And this is the same for the Moderna, right? They're the same group of vaccines. They're called mRNA vaccines. So what are the ingredients? All right, so mRNA is the only active ingredient, and then there are lipids, or a little fat bubble that helps the mRNA move into the cell. There's a bit of salt, there's a little bit of sugar, there is no virus. So what happens? So we give that injection into the arm, and what happens? I think someone might have just muted me, my accent, sorry. Okay, so what happens then at the injection site, this muscle we call the deltoid muscle? So the mRNA enters the outer component of the cell. That's called the cytoplasm, not the nucleus, not where your DNA is. mRNA is what we call a recipe. It's a recipe that tells the body how to make a protein. And what this mRNA encodes is the recipe to make what we call the spike protein, the thing that we see on the news all the time, the nasty key that sits on the outside surface of COVID-19. Now, as soon as the vaccine has told the body to make the spike protein, not the whole coronavirus, but just the spike protein on the outside, that recipe is ripped up. The vaccine can't replicate. It can't move around the body. The vaccine residue is gone within a few days. The vaccine doesn't cross to the baby. But what happens next? So what happens next is that then there are special cells in the muscle, we call them dendritic cells, but it doesn't matter what they're called, they're in the muscle, and they now recognise this new spike protein that has been made, and they say, hey, you're something I don't know, you're an invader, are you a virus, are you a bacteria? I'm going to take it to the lymph glands in the armpit. And these lymph glands then start making specific antibodies that circulate in the blood, and they will then latch onto the spike protein if it encounters COVID-19 and activate cell death before it can do you any harm. So I say this sort of detailed explanation because it is normal to get a sore arm. It is normal to get a sore armpit or even to have some enlarged lymph glands. It doesn't mean that anything bad's happening. It's exactly what's meant to happen when our immune system recognising something new that it needs to form an antibody to. So what happens to these antibodies now? They remember, and they will increase in production in response to any exposure to the spike protein. So if coronavirus comes along with the spike protein on the outside, it gets into your nose, before it can get into your whole body system, these antibodies will neutralise it. And in the same way that antibodies that you have got from your flu vaccine or your whooping cough vaccine, they can cross in the placenta, so the baby is born with its own package of immunity, and the same crosses in the breast milk. Okay, I promise that is the end of the science. That is as bad as it gets. But I am just going to play this video, which I hope can help to explain that, just if there's anything that I've left behind.
COVID vaccines are now available. Some of the COVID-19 vaccines are mRNA vaccines, but what does this mean? mRNA vaccines are different from traditional vaccines. mRNA vaccines don't expose you to any real virus. Instead, they're made with messenger ribonucleic acid, or mRNA. This is a type of molecule that gives instructions to the cell for how to make different kinds of proteins. mRNA molecules are a natural part of our cells and how our bodies work. Researchers have been working with mRNA vaccines for many years. They are made more easily and safely in a lab than a vaccine that uses a virus. Because of this, they can also be made faster. The COVID-19 mRNA vaccines have passed many tests in labs and in thousands of people and meet strict standards from the FDA. So, how do these vaccines work? First, a COVID-19 mRNA vaccine is injected into a muscle in your upper arm. Some muscle cells take the mRNA instructions in the vaccine and make a harmless piece of a protein called a spike protein. This protein is found on the outside of the SARS-CoV-2 virus that causes COVID-19. The muscle cells then destroy the instructions for how to make the spike protein. The mRNA never goes into the nucleus of your cells, where your DNA is stored. The newly made spike protein now sits on the surface of the muscle cells. Your immune system senses the spike protein as a foreign threat to destroy. It starts making antibodies to fight anything with that spike protein on it. This will help your body's immune system recognize and fight the real virus if it ever shows up. It's kind of like recognizing someone by the hat they wear. Your body is then prepared to spot COVID-19 and fight it off before it grows in your body's cells. Fast facts to remember about COVID-19 mRNA vaccines. They help get your body ready to fight off the COVID-19 virus before it makes you sick. They don't use any live, dead, or weak virus. They can't give you COVID-19. They don't affect your DNA. Want to learn more? Go to cdc.gov to find more.
Okay, I suspect you couldn't possibly want to hear more. Okay, so that's our first question. Is it plausible? Could the vaccine contain dangerous components? I think what we've worked out is that the vaccine is just used to stimulate the antibodies in our blood system, in our immune system, in exactly the same way as if we were exposed to COVID-19, but we don't pick up all the increased risks of severe disease to us and the baby. So the answer is no. Second question is, what do we know from other vaccines in pregnancy? Can we learn from them? So let's just remind ourselves what sort of vaccines we've got out there. So some of them are called what we call viral vector vaccine, and how that works, it uses a harmless virus to deliver the DNA, to make the mRNA exactly the same as the Pfizer, to make the spike protein, to stimulate the immune system to make antibodies. All right, so this is a technology of a vaccine that has been used for Ebola, and this is the mechanism of the AstraZeneca vaccine. And this has been used in pregnancy, particularly for Ebola outbreaks. And many of you would know the Janssen, which is the US form, and the AstraZeneca has also been used in pregnancy. Then there's whole virus vaccines where you grow the virus, but then you kill it with heat or chemical, but it's still got the spike protein to stimulate the immune system to make the antibodies. So you can see all of these things end up at the same place. You need a spike protein to stimulate our immune system to make the antibodies. But you can imagine a whole virus, it takes a long time to grow the virus and then to inactivate it. But we've got viruses like this, measles, mumps, rubella is what we call a live attenuated virus. And then we've got inactivated viruses. These are things like influenza or whooping cough. And we know that these are really effective in reducing illness, hospitalisation, improving pregnancy outcomes and providing benefits to the newborn because of the antibodies across the placenta. And so that's for both flu and whooping cough, and that's why both of these are recommended in pregnancy. And then the final group is this group, the mRNA vaccines. And there's such a great development of technology because they just actually give the body the instruction to make the spike protein rather than having to come from a virus itself. And then that spike protein stimulates the immune system to make the antibodies. And both of these are Pfizer and Moderna are mRNA vaccines. Okay. So what do we know about other vaccines in pregnancy? They're awesome. We know they're really effective in protecting mums and babies from harm. So then your final question will be, what about this vaccine in pregnancy? So the first thing is it safe for mum? So I apologise in advance that there are a few papers here, but just for those of you who I know are looking at the literature a bit, I'm just going to summarise the key papers. So this has come from the most prestigious journal in the world, the New England Journal of Medicine, and it's looked at women who've been exposed to an mRNA, so Pfizer or Moderna vaccine, and nearly 36,000 pregnant women received it. And the side effects and adverse reactions were generally less common. So the dark blue is pregnant and the light blue is non-pregnant. And you can see, although there was a tiny little bit more pain among pregnant people, fatigue was less, headache was less, muscle aches was less, chills was less, fever was less at both first and second dose. So we do think it's a safe vaccine that, if anything, is less likely to cause side effects in pregnancy. And then if we have a look at what happened during and after the pregnancy, this is the 827 who had fully completed pregnancies, and there were no safety concerns. By that I mean no increase in miscarriage or stillbirth, no increase in preterm birth, a baby being born small with abnormalities or passing away as a newborn. So we think it's safe. Does it work? Yes, it works. So this is a JAMA paper, so again, a very prestigious journal, published in July, of 7,500 pregnant women and people what we call matched controls, right? That is, they were otherwise exactly the same age, BMI and so forth, but they didn't have the vaccination. And if you look at the rates of infection, you can see that there was an 80% reduction in the risk of infection, let alone the risk of hospitalisation and death. And they also followed up all these women as well. And again, the risk of miscarriage, growth restriction, preeclampsia, stillbirth, and the infant weight was no different between those who were vaccinated and those who were unvaccinated. So it doesn't confer any increase in risk. But I'm sure that for this audience, you particularly like to say, what about miscarriage? Because I know that for many of you, that has been your experience. So there are two very recent papers that have just come out in the last few weeks. Again, this one in the New England Journal of Medicine. And these two studies did it in a slightly different way. This one was 2,500 women who they followed up who had had at least one dose of the vaccine prior to or during pregnancy. So the women had the vaccine and then they followed them up to say what proportion of them miscarried. And if we look at week by week by week, I'm sure, unfortunately, it's not surprising to this audience to know what the risk of miscarriage is. So this is where it's quoted to be, this paper from about 2013, and this is the rate of miscarriage among women who had the COVID vaccine. So overall, no increased risk of abortion. I'm sorry, that's the terminology the journal uses, but no increased risk of miscarriage compared to what we would have expected to see in the population. So that's have the vaccine, then follow them up for the risk of miscarriage. The other way of looking at it is find out women who've had a miscarriage and ask, did you have a vaccine beforehand compared to women who didn't have a miscarriage, and see if it's more common that among women who miscarried, they had a vaccine beforehand. And so this is now 250,000 ongoing pregnancies and over 13,000 miscarriages. So women had the miscarriage or they had the ongoing pregnancy, and then they were asked about exposure to the vaccine. And of these, about 8.5%, so this was sort of in the late of last year, beginning of this year in the United States. And this is just a statistical way of saying there is no increased chance of having received a COVID vaccine in the 4 weeks prior to miscarriage compared to the chance of having an ongoing pregnancy. And I just know there were many questions about, I heard of someone who had a miscarriage and she just had the Pfizer vaccine. Is it linked? This is why we need 250,000 pregnancies to answer these questions, because as you know, miscarriage, unfortunately, is a very sad but very common event. What we really need to know is, was there an increased chance of miscarriage among women who've been exposed to the vaccine? And I think both of these papers comprehensively tell us the answer is no. So what's our experience of this vaccine in pregnancy? It's safe and it works. So my take-home messages: COVID-19, it's not safe or recommended in pregnancy. There are increased maternal and risks to the baby in pregnancy. The mRNA vaccines, both Pfizer and Moderna, are safe and recommended. They don't contain the virus or cause you to get COVID-19. They can't get into your genetic code or into your DNA, which remember lived in the nucleus. They don't increase your risk of miscarriage or other bad pregnancy outcomes. And remember, particularly with the Delta variant, that having vaccination doesn't just protect you, but we know those antibodies go across to protect your baby. And by the adults in the house and all eligible people being vaccinated, we know that's the best thing we can do to protect your young children, given they can't have vaccination yet. And as we always say, the best vaccine to have is the one that's in your arm. So I'm going to stop the share now, and there might be questions or comments that you'd like to cover, or otherwise Vijay or Sam and I can just have a bit of a prattle on for a bit. I'm not sure if there have been any through that have come.
I've got a couple, Sue, and thank you very much for that very elegant presentation. And again, that sort of repeated message that you heard from Sue, that you heard from me, but that's what we do. This is what we do every day, whether we're talking about diabetes or we're talking about high blood pressure or we're talking about someone who's fearful for miscarriage, is try to look at the data, then translate it, explain it, reassure people. And so that's the same objective. This just happens to be a new disease. And I think, Sue, that's the biggest anxiety around this, is that concept that it's new. And there will often be that reference. And I suppose I'm just going to say it rather than pussyfooting around it, but people will talk about thalidomide. And they say, well, when people were giving out thalidomide, they thought that there was a new drug and they thought that it was fine. And then we discovered that it wasn't fine. So how do we know that we're not going to find out at some point in time that this was not a good idea? So, and that links with a couple of people who put in the chat, which is, how long will those antibodies be around? For how long will they pass through the placenta? And also, how do we know that the antibodies themselves won't cause long-term harm to babies?
Yeah. So all great and very reasonable questions. So one of the things that I have to deal with a lot is unfortunately dealing with mums who have cancer or mums who have other major illnesses. And they're often saying to me, what's the risk of chemo? What's the risk of me needing an MRI in pregnancy? What's the risk of me being on this, that, or the other medication? And when we look at medications or exposures that can be damaging to the fetus, I guess we call them, as a broad group, we call them teratogens. That is, they have a teratogenic impact. That is, they cause problems with structural or developmental putting together of the baby. And most of the time we can identify why that might have worked. Why it is that radiation causes damage to babies, or why it is that some medications, particularly chemotherapy, which can interfere with the replicating cell. That's how it works to attack the cancer cell. We know, therefore, it can be dangerous for your fertility, or there are some that we would recommend not having in pregnancy. So there's a really good science around teratogenicity, and I guess it's really why I wanted to pause and talk quite a bit about the vaccine and actually what's in it. There's salt, not a risk. There's sugar, not a risk. There's a lipid particle that carries the mRNA, and that's it. There's nothing else in it. And so there's no plausible reason that we can think of that would be able to cause any harm. And as I say, the vaccine doesn't stay in your circulation long enough that it's going to be crossing the placenta and exposing your baby to it over and over again. Now, of course, what we do have is our antibodies to the spike protein. And we have antibodies to all sorts of viruses and bacteria that we've all got already in our system. So we all would have had measles, mumps, rubella vaccines when we were young children. Any of you who've been pregnant would know that you get a whole gamut of blood tests in early pregnancy. And for those of you who might maybe work in healthcare or other things, you'll have Hep B antibodies. So you'll have antibodies to hepatitis B. We know that you'll have antibodies to rubella. You'll have antibodies to mumps and measles and so forth. And so we don't find that these antibodies floating around in our circulation do any harm by going across to the placenta and to the baby. And in fact, on the contrary, we know with things like the influenza vaccine or the whooping cough vaccine, we're actually taking advantage of that. We're actually using mums as a drug mule, if you like. She doesn't need the whooping cough vaccine for herself because she had it with the last pregnancy. But the reason we give it every pregnancy is so that the immune system gets that reminder again. Oh, remember this foreigner that you don't like? The antibody production goes up. We're relying on that flood of antibodies going across to the baby to protect the baby from whooping cough when it's born until such time as it's old enough to have its own vaccinations. Because we know that unfortunately the most dangerous time for a baby to get whooping cough is as a newborn. And unfortunately that's well before the baby's got its own vaccinations. So, of course, we would love to have 5, 10-year, 20-year data on all of these things to say, yes, absolutely nothing happens when you're 65. It doesn't cause early onset dementia and so forth. But unfortunately, we're working in a pandemic. And it's the reason that I think the best that we can do is say, is there a biologically plausible mechanism by which it could cause harm? No. Do other vaccines cause harm or good? We know they cause good. And what's our experience of this vaccination in pregnancy? It's overwhelmingly very, very good. And remember that there's no vaccine in history that's ever had an effect, an adverse effect, more than a couple of months after the vaccine's been given. It's just not one of those things that seems to be a cumulative thing like asbestos exposure in your 40s and getting cancer in your 80s. That's never happened with any vaccine. And because the mechanism is exactly the same, we wouldn't expect it to happen with this vaccine. Now, in contrast, COVID-19, we have grave concerns about what the implications are for the mum and for the baby. And seeing what we're seeing in the community at the moment, we know that your chance of coming into contact with COVID-19 now is relatively high. And that you can't just avoid it by staying home or wearing a mask or socially distancing. We all try and do all of those things, but it doesn't absolutely protect you from getting it. And we do know that if you do get COVID-19 and you get sick with it, then that definitely confers risks to the pregnancy and, most importantly, risks to yourself. So I hope that helps a little bit in terms of putting people's mind at rest.
And then just one, there's two more that have come up. One is, I think, relatively simple, actually, I don't even know if we know the answer, but how long do the antibodies last for? So that I think is relevant. And also, how long did they last for in breast milk?
Yeah.
I don't know how much we know about that yet.
Yeah, that's right. I think that at the moment, a lot of people have asked that, and you would all be pretty familiar with the whole discussion about booster doses and how do we know how long before you'll need to have a booster dose. And we just know that doing blood levels of your antibody doesn't seem to reliably predict your protection. So I guess what I'm saying is that you can have antibodies for quite a long time, but they mightn't necessarily be very strong or very active antibodies. But I think that if you have it during pregnancy, if you have one or your two doses during pregnancy, then I think we would expect that those antibodies would last for the duration of that pregnancy. I know in America, they're starting to talk about booster shots for pregnant women who had their course of vaccination more than 6 months ago. Now, we haven't got very many people in that situation in Australia because our vaccine rollout's been a little bit behind the States. But I guess it suggests that there might be waning immunity over the course of that time, perhaps a little bit more for Pfizer than for Moderna or AstraZeneca.
And Sue, I might roll a couple of questions into one because for this audience as well, they're trying to get pregnant.
Yeah.
And so I think we did address well the fact that there's no evidence of impact on the sperm or the egg. But one of the things that comes up is the impact on the menstrual cycle. And that seems to be a fairly commonly discussed issue. And my question to you would be, what do we know about the impact of COVID vaccinations, both AstraZeneca or mRNA vaccines, on the menstrual cycle? And two, should that influence somebody who's trying to get pregnant? And three, I'm going to roll them all into one. Looking at a group of people who might be going through IVF, should the timing of when you have the vaccine, does it matter if you have it on the day that you have the transfer or the day before or around that time?
Yeah, great. They're all really important questions. The first thing relates to the menstrual cycle, and you're right, there has been a little bit of scientific research and a lot of anecdotal data saying that people, particularly after the Pfizer vaccine, that they seem to have reported that their menstrual cycle has changed or altered. And of course, it doesn't take any of us very long to leap to, well, if it does cause a change into your menstrual cycle, then it must be interfering with your reproductive function in some way, and therefore couldn't it be not a very good thing to be doing around the time of conception? I guess I would just go back to sort of what we were saying earlier on. The only thing that's in your bloodstream and therefore is travelling to your ovaries and travelling to your uterus is an antibody that is just mooching around looking to make sure that there's not a spike protein that's entered your body in the form of coronavirus. So again, there's really no logical reason to think that this would cause any harm to ovaries and eggs or sperm or menstrual cycle. But I think it's quite possible that people do, what their experience is true, that it has changed their menstrual cycle. And I don't know the answer for sure, but my own suspicion is this data is obviously, it takes a little while for things to come to publication. And I think sometimes these might have been people who got vaccines fairly early on. And what I mean by that is that these are often, as you know, healthcare workers were prioritised, and females are the overwhelming majority of healthcare workers, and particularly in reproductive age. And so I suspect that, and as everybody in this call would know, stress can interfere with your menstrual cycle. And I suspect that a lot of these women might have been working in quite stressful environments, and either the process of having the vaccination lowered the levels of stress such that it changed their menstrual cycle back to where it was, or they might have actually been working in quite stressful environments, which means that they were a little bit more vulnerable to their menstrual cycle being disturbed. And likewise, I think there were many women during that time who said, I'm going to get vaccinated because I'm planning to have a baby. And of course, when you're planning to have a baby, then you might have might continue with the pill while you're being vaccinated, and then stop the pill as soon as you feel like, okay, I'm now safely vaccinated, I'm going to go off and get pregnant. And so, as many of us would know, when you've come off the pill, you go off that lovely, artificial, well-regulated cycle back to your own regular or irregular or heavy or whatever cycle. So I guess they're the sort of reasons that I think I could see why we might have seen it, but wouldn't be due to the vaccine itself. Now, the second thing then relates to what about IVF, and should you delay a treatment in view of the vaccine? I absolutely wouldn't. I just, again, for the same reasons, I just don't think that there's any reason that we think that it will interfere with how the vaccine works or how your IVF cycle is going to run. I just can't think of any reason why that would cause any problem for early implantation. And I'm just going to pick up on one other thing, because a couple of the questions that came to us beforehand, there were some really thoughtful questions around immune activation and what risk does that confer to pregnancy. And someone had looked up a couple of articles from really good papers about that. And that's a really important point. We know that very strong immune hyperreactivity in pregnancy is not such a good thing. But that's not getting a vaccination and getting a specific antibody to an antigen, or what we call here the spike protein. This is the immune activation that we are talking about when someone gets really sick. And actually, ironically, it's immune activation which is the biggest killer with COVID-19. You're probably aware that people can get fever and muscle aches, and they might get pneumonia from the COVID-19. But the thing that ends them up in ventilators is the immune activated lung injury, where the immune system turns against the lungs and starts to make them very thickened and hard to ventilate and so forth. So it's that sort of thing, immune activation. That's what we're talking about when we're talking about immune activation being bad in pregnancy. And so we worry about people who get sick with appendicitis or kidney infections or get the influenza and so forth, because these things are bad for pregnancy. But getting a simple antibody reaction to a vaccination is not what we would call immune activation.
Thanks, Sue. So we've just gone past the hour, and I'm just going to wind up, but I'll do that by answering a couple of questions as well. And I think that what this comes down to is, and just to cover off one, which is about the timing of vaccination in pregnancy. There's no evidence that, as Sue said, the best time to get the vaccine is now. The best time to be protected against COVID is now. And so therefore there is no reason to delay or to look for a safer period of gestation. And just so there isn't confusion, the reason why we say whooping cough or influenza vaccination later in pregnancy has got nothing to do with the safety in terms of the unborn baby. It's more about the protective effect that it will have on the unborn baby, because then the baby will be carrying those antibodies which have crossed the placenta. So that's the reason for doing it after 20 weeks or at a later gestation in the late second or early third trimester. The other thing, which I think is really in many ways the whole picture, is, but how do you know it's safe and it's new, and that seems to be a repeated question, and that's fair enough. Maybe we could answer that question in a different way, which is what we are 100% clear on is that COVID is not safe. That's indisputable. COVID is not safe. COVID will be a risk to you. COVID will be a risk to your baby. So therefore, don't get COVID. How can you not get COVID? You can isolate yourself, you can live in a bubble, it's not going to work. Every human on the planet is going to be exposed to COVID at some point in time. That's the nature of this disease, particularly the Delta variant and potentially variants still to come. So therefore, if you are going to be exposed to COVID, no matter how much you wash your hands or wear a mask, the best way to protect yourself is with the vaccine. And what do we know? We can only know what we know. We can't know about what happens after 5 years because it hasn't been around for long enough, but we can go back in time and understand the development of these vaccines. We can look at the biological way it works. We can think about biological plausibility, and to the best of our knowledge and with a lot of thought, we do believe that the vaccine is safe, it's effective, and it will protect you and protect your babies. So you can hear in my voice, I'm sure, you can hear from the message that Sue's given you is our sense of wanting you to be vaccinated. You know, that's why we turn up and do these webinars, is because we want to look after you in this part of pregnancy and your health in the same way that we want to look after you in every other part of your pregnancy and your general health. And it's our sincere belief that vaccination is safe and it's effective and it will protect you and your baby. So on that note, I would like to thank Sue. Thank you very much, Sue, for being here, for sharing your expertise, for that wonderful presentation, just for the kindness with which you gave it as well. Thank you, Sam, for inviting us to be part of it. To Andre, who has put all of this together, thank you so much. And to all of you who are on the call, thanks for being here tonight, for hearing our presentations. We hope that it's reassuring for you. We remain available to you, your doctors, your midwives. We care about you. And finally, as I started at the beginning, absolute recognition to this audience, to the whole Pink Elephants community. I've learned a lot about talking to each other, the importance of not just being talked to by doctors, but by listening to each other and learning from each other and supporting each other. I think that's a wonderful thing. But from us, as the people who care for you, we acknowledge your loss. We acknowledge the babies who are not here, and we value them. And we wish you every happiness in hopefully your next pregnancy to come, and generally as we come out of this pandemic together. Thank you.